Okay. Can you hear me properly?
I can hear you. Can you hear me?
Yes, yes, I can.
Hmm?
Okay. So hi, Dr. Aruna. Hope you are doing well. If you just want to introduce yourself, we can start with the introduction, and then I'll go ahead and uh, just ask you a few questions on why it's important to talk about reproductive and sexual health for millennials, because I feel that a lot of millennials, and like because of the availability of all the information on Google or on social media, we don't actually consult a doctor or a expert when in terms of any reproductive or sexual related questions, or any questions. We just find it very easy to go to Google, type in a question and get answers. But I think that should not be the case, and that is why I wanted to just talk about their reproductive health, and you can tell me whether this is a myth or a fact. So if let's start with your introduction first, and then I'll go ahead.
Hello.
You're not audible.
Mhm.
I can't hear you.
Okay. Um, can you hear me? No.
Yes, yes, I can. I can.
Can you hear me? Okay. So shall I say?
Yes.
So hello everyone. Good evening. I'm Dr. Aruna Kalra. I'm Director Obstetrics and Gynae Department at CK Birla Hospital, Gurgaon. So as our host has suggested that let's talk about reproductive health and how Google is destroying uh, the first-hand information which you should get through proper gynecologists. And that's why we would discuss today how important it is to have a direct information from doctor, and these short bypassing doctor, how it is affecting your reproductive health. So let's talk.
Okay. So I'll start with the first myth that we see, that usually, people feel that the pull-out method is safe, and if that happens in a at the right time, that there are no chances of getting pregnant. So is that true, or it's a myth?
Okay, so let me tell you one thing, Palak. There are many methods of contraception, and these are natural methods of contraception, which you suggested that okay, pulling out before ejaculation, whether this is the safe method, one, whether it's effective, 100% effective, and 100% reversible. So, what we say, any contraceptive method to be effective should be 100% effective and 100% safe, okay, and 100% reversible as well. Now, effective depends, and how do we calculate is if 100 couple use one method of contraception for a year, for 12 months, how many are getting pregnant, or that is called failure rate of that contraception or effectivity rate of that contraception. So if we are using pull-out method, there are chances that 25 couple per 100 couple in a year might conceive. So that is the effectivity or the failure rate of it. For that matter, if we use condom, there are chances that 17 to 20 people might conceive even with condom. Okay, with burst condom, with slip condom. So that is again a failure rate of contraception. This is barrier method of contraception or condom. Uh, once we so if we are young from the age of 17 or say 15 also sometime, till the age we are not ready to conceive, whether it's pre-marriage or after wedding, till the time we are not ready to conceive, we should be using 100% effective contraceptive method, which is 100% reversible also. So when I say reversible, it means that as soon as I stop that contraception, I should be able to conceive the next month. Okay, that is the effectivity rate. So if we are talking about young couples who are, say, in their colleges or studying, and they're not ready for conception yet, okay, for them oral contraceptive pills, one, is the safest as well as effective and reversible. Second is vaginal ring, Nova ring. So I would say that okay, everybody would not be able to consume oral contraceptive pill because of one is it has to be taken daily. Sometimes people have nausea. Sometimes people have any other side effect of hormonal side effect. Those people can go for Nova ring, which is vaginal ring. It is similar to 21-day course, so you have to insert inside the vagina. It will stay there for 21 days, hook it out after 21 days, give a gap of 7 days, and then again insert another ring. So it is oral contraceptive made easy, it is made vaginal. Okay, estrogen progesterone insertion is vaginal ring. So that is the method of choice for new couples. Okay, as you suggested that whether pulling out method is good or not, it is good, but accidents happen accidentally, we know that, whether it's pull out method or whether it's barrier method of contraception or whether whatever it is written in books that it is not 100% safe or 100% effective, or it has many failure rates, so you have to accept that. You just cannot say that okay, I was using this and I still I conceived. Yes, you could conceive, because we know that failure rate is 25 per 100 couple per.
So, talking about the pull-out method only, like you said, it's good, but failure can happen. But there's a concept called pre-ejaculation, right? So, how, I mean, is it like always possible that, if, what I have heard is that the pull-out method is not safe at all. You should, because condoms protect you from STIs as well as the getting pregnant. So, as a gynecologist, would you suggest the millennials out there that they should go ahead and experiment with the pull-out method, or they should always use protection?
So as we said, that fun is even if it is used, if even if we perform it very effectively, still there are chances 5 per 100 couple, and pre-ejaculation fluid before ejaculation also contains sperms. Okay, so it's not only after ejaculation you can conceive. You can conceive even at foreplay, even when there is no ejaculation. So those that fluid also contains sperm. So that is not effective method of contraception. Okay, enjoying is another thing, but effective method. This is not an.
Okay, okay. So going to our second myth, there's a myth like a lot of because of the lifestyle changes, and a lot of the teenagers and millennials are going ahead and having food outside, which is due to which the number of PCOS cases in young women are increasing, and there's a myth that women with PCOS cannot get pregnant. So, what is the solution? How one should, how a woman who has a PCOS should calm herself down that this is a myth? Like, what would you like to say about pregnancy and PCOS?
Okay, but let's see. I would not say that it is a myth. People are eating out. Uh, they are not focused on their health at all. And I should say that see, if you consider me or you or anybody rigorous or a job which is like, hello, can you hear me? Okay, so 12 hours job you are having. You got up early. You did not have time to walk or exercise or go to gym, and then after 12 hours, say you came back at around 8 or 9 o'clock. Okay, that is the time you will be having one major meal, which is a wrong time to have a major meal. Okay, because after that you are going to sleep within 2 or 3 hours, and throughout the day either you had some junk or other, because you did not take your proper lunch, fruits, dry fruits, dahi, everything. You did not take that. You did not have time. Neither you like to take that. But then you had burger or whatever, samosa, whatever it was, so the whole routine is wrong. One, we never ever have time for exercise for ourselves. Young couples, and this is really sad to say that even if we say that if we are talking about girls, they are getting obese. Uh, their ovaries are not functioning properly. Because of that, chances of diabetes, hypertension, hair fall, dark pigmentation under the breast, nape of neck, everywhere. So acne, facial hair. So cosmetically also, you are bothered. Obesity also affecting your diabetes and hypertension and affecting your health in bad way. Your knee joints are getting affected. And for boys also, they are developing hypertension, diabetes, and cardiac arrest. So for everybody it is wrong. Unhealthy lifestyle is leading to obesity and insulin resistance, which is a causative factor of PCOS. And if you have PCOS, you would not have regular periods. Either you'll have after 2 to 3 months or after every 15 days. That suggests that your ovaries are not ovulating or not producing or releasing eggs properly, and that is why abnormal hormones are getting pent up in the system, which is causing acne, extra facial hair, baldness, or hair fall, all these things. And again, fertility is affected because eggs are not getting released. We need egg for proper fertility, for proper periods. So if we are not having regular monthly release of one egg, it would definitely affect your fertility. And treatment is so simple. You have to get up early, you have to go for 1 hour walk or run, you have to make a proper breakfast, which is porridge or stuffed roti or whatever you like. Fruits, you have to take fruits, curd, dal, sabzi, everything to your workplace, so that you have a proper meal at your workplace. You should not be craving as soon as you come home and have pizza or elaborate meal. That should be, supper should be really light with only dal, vegetable, or double tone doodh or something. So that's what it is. So yes, PCOS is there. It is a lifestyle disorder. It can be corrected with disciplined lifestyle.
And like, I mean, but women with PCOS can have babies, right? There is always a solution, and if we correct the like, is there a possibility to reverse PCOS?
It is. It is a reversible disease. It is a lifestyle disorder. You reverse your lifestyle and it is reversible. It's not a disease at all. That's what we are telling everybody, that it is not a disease. It is your wrong lifestyle. You correct it and it will be corrected by itself. It is a syndrome. It is a disease of collective everything. Like if abnormal hormones are there, everything would be affected. If you correct your weight, if you correct your lifestyle, everything would be corrected.
Hmm. Okay. So usually, like if someone is not able to get pregnant, it is said that the woman should get some medication or some tests. But like, is infertility only a woman's issue, or men also suffer from infertility? And um,
Mm-hmm.
yeah, what do you have to
Okay.
say about
So
this?
is it okay? So again, if somebody couple is not able to conceive, when they come to gynecologist, we know that there are multiple reasons. Sorry, we know. Can you hear me?
Your video is not there. I can't see you. Yes, yes, I can see you now. Hello, Dr. Aruna, can you hear me? Hello.
Hello.
Yes. Can you hear me now?
Yeah, I can. I can hear you.
Okay. Okay. Yeah. So you were saying something.
So I was saying that when couple comes to us that they are not able to conceive, we know that 30% chances are there that female would be the cause. There might be a cause with female, or 30% chances that male factor fertility would be there, or 30% chances that both may be having some or the other issue, and we have to correct both. Okay, and simplest test which we ask them to do, first test which we ask them to do is getting semen analysis for husband after 3 days of abstinence, and simple one ultrasound for female. So at least we should know that female has normal uterus, ovaries are normal, not PCOS picture, and semen has sperms, or if it is there is infection or something we can treat. So simplest first test would be semen analysis and ultrasound, which is non invasive tests, which are easy to get tests, and at least we have a baseline idea whether male is there is a cause of infertility with male or female. And then if we find that there is something with male, we try to treat male factor first, because it takes 3 months from sperms, abnormal sperm, to grow to normal sperm if it is treatable. So yes, it is always suggested that male factor be should be checked first, and should be checked. Male factor should be checked first before we check female for fertility.
Okay. Um. So for, am I audible?
Yeah, yeah. Go
Okay.
on.
So if you want to share an experience, being a gynecologist, I'm sure you must have come across a lot of, college girls coming to you and asking for solutions. For example, what if someone, had an experience where the condom was not properly, like something happened with the condom basically, and what should be done, like what should be the immediate action of that person, and because as you know, when they get to know that this was not protected, so what should be done next?
Okay. So let's come to the patient. So if patient has come with broken condom or slipped condom, and she is worried that she might get pregnant. One thing is might get. Another thing is that it was just passing this thing, and she might get sexually transmitted disease. So there are two concerns mostly. So one concern is that okay, we try to check when is her fertile days, when are her fertile days, and whatever. If it is not around fertile days, we try to pacify. But if it is actually on during fertile days, we always say that abstain. Do not take morning after pill. Absolutely not to be taken, because if pregnancy has happened and you take morning after pill, it will make your uterine environment, womb's environment, hostile for pregnancy, and pregnancy would stuck in the fallopian tube, which is absolutely a wrong thing, because we have only two fallopian tubes, and if one is blocked, or if in one tube pregnancy is has happened, which is called ectopic pregnancy, we have to sacrifice that 50% of our fertility. So it's always better to let the baby come, or pregnancy conception come in the womb, and we have safer methods of abortion, like say tablets, which or even if we have to go for suction evacuation, that is absolutely safe method of abortion. One is that. So do not take morning after pills ever. I'm so sorry.
Right.
And what about is whether they would get sexually transmitted disease, because that fellow was not known, or it was just accidental this thing. And again we say that okay, don't worry, it's not going to show you symptom immediately, even if there is some kind of sexually transmitted infection, whether it's viral. Mostly people are worried about HIV, or whether it's gonorrhea or chlamydia or fungal infection or whatever it is. It is going to take few weeks time, but and we do not actually need to give antibiotic right away or do tests right away. We'll have to wait for a month, and we can do your blood tests and your pap smear and your hypogeneral swab, everything, and with one accidental unprotected intercourse, chances of getting sexually transmitted disease or some kind of grave disease are really, really not high. So you should not be worried. But again, we take this opportunity to explain it to them, the advantages of barrier method of contraception and vaginal ring and oral contraceptive pills, because now at this point of time they are very receptive. They had an accident, and they are receptive for cervical cancer vaccine, which is a vaccine against human papilloma virus. So we give them advice to take that HPV virus vaccine, get pap smear regularly, and use proper method of contraception.
Okay. So just last question. Now that you've mentioned about HPV, can you tell us more about what the HPV vaccine is? Because I think it's important that people like women especially know about this vaccine and get vaccinated on time. So what is the age group that one should is eligible for the HPV vaccine, and everything in short, if you can tell us about the HPV.
Okay. The name of virus is the mouth of the uterus. So cancer of mouth of the uterus or womb is called cervical cancer, and because most cervical cancers are caused by human papilloma virus, which is HPV. We have developed a vaccine against HPV virus, so more than 90% of cervical cancer can be prevented by giving HPV virus vaccine to young kids before the age of 15. So if they are less than 15, two doses are required, zero, like first dose, and then after 6 months, another dose. HPV virus, as we suggested, that it is a virus, it can be transmitted to boys as well as girls during sexual activity, and that is why, and during oral sex or other sexual activities. So it has to be given to boys as well. Under the age of 15, zero dose, and then after 6 months, another dose. That is the best time to get HPV virus. But if you have not had your virus vaccine, HPV virus vaccine, you can get another best time is less than 28 years of age. But after the age of 15, you have to get three doses: zero, 2 months, and then 6 months. So after first dose, after 2 months, second dose, and from first month, 6 months is the third dose. After first dose, 6 months is the third dose. But we say that okay, if you have a single partner, if you are like you're wedded to, and like that it is single partner, you are getting your pap smear done, it is always normal. You can get HPV virus vaccine till the age of 45. Okay, so even if you have contracted HPV virus, still there are many strains which you would be protected against if you have not already contracted. So this is the only vaccine against cancer, because this cancer is caused by repetitive uh, virus infection, which is only the human papilloma virus, which is the cause of cancer.
Okay, okay. I think there are a lot of campaigns going on social media. Like I've seen a lot of pages talking about the HPV vaccine. But I hope like after this live session, people get to know about this vaccination, because I think this is very important, because a lot of millennials and like they are sexually active, and protection is something that they must follow. Like you said, there are oral contraceptive pills. Condoms also have like there are possibilities that you can get pregnant or can get STIs. So vaginal rings are there. So I think it's best to consult a gynae if you are sexually active, and an expert can only tell you the best ways to stay protected. Any advice that you would like to share for the audience, to the audience, so that they are
Okay.
whatever decision they take is right.
Um, uh, Only one advice I would want to give that see, you got to know about HPV virus, you got to know about healthy lifestyle, but still you would be having many questions towards contraception. Okay, and when it comes to say oral contraceptive pill or something, your parents, your grandparents, your all other relatives would come forward and say, okay, it can cause for infertility and it is harmful and this is hormonal and all those things. So, but please understand that it is oral contraceptive pills are there since ages, and these are really safe. Uh, People who are getting married also, they don't feel or they don't feel a need to go to gynecologist before their first night, before their, and they think that okay, they'll just pray to God and they won't conceive, though they do not want to conceive for another 3 years. Uh, Even educated couples nowadays, as we started this conversation, feel that Google is the best teacher or Google is the best doctor. But let me tell you that uh, there are many wrong informations there, and to pick which is right is so difficult in the vast ocean of information at Google. So it is always better to go to specialists and do not be afraid of using oral contraceptives. These are safer, 100% effective, and 100% reversible.
Okay, thank you so much, Dr. Aruna. It was like a very informative session. So, I mean, this will be saved on our community and on YouTube. So, I hope people go and see this live and get educated. Thank you so much again. Okay, bye bye.